My name is Dr. Ruth Doughton. I'm a board certified adult psychiatrist, and today I want to talk about how to tell if you have insulin resistance. We've talked about in prior videos why insulin resistance matters for mental health, that it's not only associated with conditions like bipolar disorder and major depressive disorder, but we have strong reason to believe that there's likely also a causal relationship there. So how do you tell if you have it? Well, there's 4 basic ways that you can tell. The first is going to be through a test called a hemoglobin A1C. Now, this is the least sensitive test and the one that I recommend the least. But it is a test that your primary care provider is likely to order on an annual physical exam. So this test is a measure of the average blood sugar levels over the last 3 months. And if it comes back at a value greater than 5.6 for most labs, then that's going to be in the pre-diabetic or insulin resistant range. Of course, if it goes high enough, like over 6.2, 6.3, then that's going to be in the diabetic range. Now, the reason I say that I recommend this the least of all of the different screening measures that I'm going to talk about is because you can have developing insulin resistance for years before you notice any change in blood glucose levels. So by the time your blood glucose levels are starting to be abnormal, you have pretty advanced insulin resistance and are well on your way towards developing diabetes. So the other 3 are going to be able to detect insulin resistance far earlier. So the best way is going to be through a fasting insulin level. Now, although this is not something that primary care providers are routinely testing for, it's a cheap test and most labs are going to have the capacity to test for it. If your insurance doesn't cover it, it costs about $15 out of pocket. So we don't have standardized values for what's normal, but it's generally accepted that if your fasting insulin level is 5 or less, that's excellent. If it's between 5 and 10, that's still pretty good. If it's over 10, then that's showing that you likely have insulin resistance. And of course, the higher it is, the worse your insulin resistance is. So if you don't have access to that test or your doctor won't order, there are a couple of other screening tools that are also very helpful. So one is looking at your triglyceride to HDL ratio. And this is something that you're going to be able to tell with your fasting lipid panel, which again, just like the hemoglobin A1C, is going to be a lab test that your primary care provider is likely to order during your annual physical exam. So if this triglyceride to HDL ratio is greater than 1.5, then you are at increased risk of insulin resistance. And this is because the triglyceride level is kind of a proxy to our blood sugar level. So the higher the triglyceride level, the more likely you are to have had elevated blood sugar levels over time. So let's say that you can't get in with your doctor or they're not ordering labs. One easy at-home screening measure that you can do is your waist
to height ratio.
And so all you need is a tape measure. And so you're going to measure your narrowest point and divide that by your height. If that value is greater than 0.5, again, this is going to indicate that you are at increased risk of insulin resistance. Now, all of these are screening tools. They are not perfect. That means that they're going to miss some people who do have insulin resistance, and they're going to include some people who do not have insulin resistance. But if you're able to get multiple of them and multiple of them are showing consistent results, then that's going to point you more in the direction that you do or do not have insulin resistance. Symptoms of insulin resistance that you might notice could include things like feeling fatigued, having brain fog, having excessive growth of skin tags or a darkening of the skin, excessive hunger, like needing to eat every 2 to 3 hours and getting hangry if you aren't able to eat that frequently. And of course, the tendency to gain weight, particularly in that abdominal region. Wishing you all good mental health today, and I'll see you in the next one.